Hello, this is Dr. Sujeet Jha. I'm Senior Director Endocrinology Diabetes at Max Healthcare, New Delhi. So today's topic is about diabetes and hypertension. I think diabetes and hypertension coexist. If you talk about diabetes and if you don't talk about hypertension, the whole job is incomplete. Because the diabetes is associated with not simply hypertension, high cholesterol, and that's another risk factors for cardiovascular disease. So if you just treat diabetes and if you just ignore hypertension, that's a completely incomplete job. So the risk factors for diabetes and hypertension are similar in the sense that people with obesity, poor lifestyle, lack of exercise, family history, poor fruit intake, poor high fiber intake and vegetables, they are more risk for diabetes, and they are the same risk factors. But in regards to hypertension, it is the salt intake which also majorly contributes towards hypertension. And if you both combine diabetes and hypertension, it's a very bad cocktail in the sense that they tend to have more risk of complications due to heart disease, cardiovascular deaths, heart failure, kidney failure, effect on eyes, and also strokes. So the diabetes in combination with hypertension tends to have much worse outcome compared to either diabetes alone or hypertension alone. The question is that what should be your target in hypertension? So people with diabetes should have much more strict control of hypertension, and it should be around 130/80. Anything above 140/90 should start thinking treatment, which may not require medication but require lifestyle changes, which I'll talk later. But it's very important to achieve a goal of lower than 140/90, and preferred 130/80 is a preferred patient diabetes. Because with diabetes and hypertension, if you have protein leakage, you have more risk of kidney failure, and that's one of the biggest killer in patients with diabetes. And in regards to heart disease, the same theory applies, that if you just treat diabetes, don't treat hypertension, and similarly the cholesterol. So the whole spectrum of disease needs to be treated well. So diabetes is not just alone, it coexists. And the reasons behind are similar because the diabetes tends to have the same inflammatory process which makes you prone to have heart disease and has effect on the vascular endothelium, and same thing as long as the hypertension is concerned. The question is that how should we treat it? Definitely the treatments are two different arms, which is lifestyle and the blood pressure medications. And there are straightforward treatment for hypertension in cases of diabetes. Salt reductions to as much as possible. I can tell you that their blood pressure gets sorted much easier than diabetes if they cut down the salt intake. And the salt intake cut down to negligible will bring the blood pressure normal. Do we need salt in the body? Yes, we do need salt, but that comes indirectly from eating any food. You don't need to have an extra salt, like processed food, like achar, papar, or anything else, right? It should be cut down to minimal. People also don't understand that hypertension can be controlled by eating more fruits. Now, can you eat fruits in people with diabetes? The answer is yes, yes, and yes. So diabetes can be controlled by fruits, and the fruits are good for not simply for your diabetes, but also for the hypertension. So you need to bring the blood pressure down, cut down the salt intake, increase more fruit intakes, and walk minimum 30 minutes a day, which is around 150 minutes a week. Besides controlling obesity, controlling your fat intake, which had direct impact on cholesterol, diabetes, and overall lifestyle changes. It is also true that yoga also tends to affect the hypertension. And in summary, that every patient with diabetes should have their blood pressure checked up, they should be controlled. The lifestyle changes are similar as the same reasons for diabetes and hypertension. In particular, the hypertension should be looked into from the salt intake point of view. And if you modify your lifestyle changes, cut down your obesity, cut down your fat intake, more walk, more exercise, increase your fruits intake, will treat your diabetes and hypertension together, so that you have a longer life, you have less chances of putting stent put in, bypass surgery, or kidney failure. So I'm talking about hypertension and prevalence. The prevalence of hypertension globally is very high, and up to 10.2 million deaths has been reported to hypertension. And hypertension, as far as India is concerned, it is almost like 1/4 of the population can have hypertension, which is 25%. Little higher in male, up to 13.8% in that 15 to 50 age group, compared to around 8.8% in females. And if you translate into that, it's almost like 207 million people are suffering from diabetes, and around 1.63 million deaths is related to hypertension-related deaths, which includes cardiovascular disease, stroke, kidney disease. Now, what are the determinants for the hypertension? Who can get hypertension? Unfortunately, the age is important. By age, your hypertension tends to go up. But in the current population, even the younger people, because they have been obese, they have processed food, high salt intake, the blood pressure is increasing even among the younger age group. And the salt intake, when you say salt intake, how it's gone up. If you look at anything processed, that what we eat has got salt in it. Anything which is mithai have no salt, but anything which is not mitha has got processed in it, which includes either any noodles, any pastas, or any processed food, including the bread, can have extra salt intake. So indirectly, the amount of salt intake, we can go up to 14 to 15 grams among Indians. The second factor is obesity and overweight, which is again related to the processed food, not enough exercising. And if you start exercising and cut down your weight, even 1 or 2 kilograms body weight reductions have a huge impact on your blood pressure reductions. So if you found to have a newly diagnosed hypertension or established hypertension, you need to cut down your body weight and obesity. The poor dietary, which is a combination of extra fat, processed food, maida-based products with adding an extra salt, contributes to it. Now earlier, the alcohol was around 25 to 30 units up to 20 units. Now the current recommendation is the lowest possible up to 10 units. 1 unit is approximately 25 units of whiskey equivalent, so you have to cut down alcohol units to around less than 10. Stress, which is all possible with the modernization of the country, with the way we are living, the urbanization, leading to stress and lack of exercise, has a major contribution towards the hypertension. If you have high cholesterol, it also adds up to hypertension. So people with diabetes, people with high cholesterol also have hypertension. The world has learned, the Western world has clearly learned that the scientific way of bringing the blood pressure, sugar, cholesterol down. Yet it's true that it can be done primarily by the lifestyle. Not everyone would need medication, but the lifestyle remains more important, which includes basic 30 minutes of exercise, eating more fruits, fiber a day. The 5 fruits, fiber a day, including mango, banana, chiku, any fruits. Fiber means even a garlic or even the onion include the fiber intake. So you have to increase the fiber intake, and that will reduce the blood pressure. When it comes to masala, there are several things in masala. The worst thing in masala is about the salt and the oil intake. The other masala, which is jeera or something else, is not that harmful to you. If you take a lot of masalas, you need to cut down the salt and cut down the fat intake, and that will help your blood pressure reduction. And quitting alcohol, cutting down alcohol, stress reductions, quitting smoking. Smoking adds up your heart disease risk. Smoking also increases your blood pressure, and if you have smoker on the top of diabetes and hypertension, that adds up 10 times more risk of having heart disease. So it's very important to start getting screened right at the age of 18 for your hypertension, which is a simple machine which can be tracked by an automatic machines. You don't need a traditional machine to do the blood pressure, and it can be checked. Screening is important. Talking to your dietitians, cutting down salt intake, walking, cutting down your weight, and obviously talking to your GP and physicians is very important. So screen early, pick up early, because what's happening that if you have hypertension at right at the age of 18 or earlier age, if you add up diabetes, add up cholesterol, add up smoking, adds up alcohol, that risk to that 35% increase in heart disease last 10 years' time. Enjoy your life, but make sure you cut down alcohol intake. Don't smoke at all. Cut down salt intake, and yoga and exercise and walk is very important to prevent diabetes, blood pressure, cholesterol, and what we call as the cardiovascular risk factors. So thank you very much.